Hi, you're here today because you want to learn about breastfeeding, and it's great because that's one of my favorite topics to talk about. So you're probably aware that there are a lot of benefits to breastfeeding, benefits for baby, such as lowering risk of SIDS, respiratory illness and diarrhea prevention, fewer ear infections, also decreases risk of childhood obesity, type 1 diabetes later in life, and childhood cancers. But there are also a lot of benefits for mom. It reduces risk of cancer in all of our organs that are associated with our reproductive system, such as breast cancer, uterine, endometrial, and ovarian cancer. But later in life, it protects us cardiac-wise, and that particular benefit is actually linked to any amount of breastfeeding. Some of these other benefits are linked to how long you breastfeed. The longer you breastfeed, you're more protected for cancer. But it also helps decrease use of insulin in diabetic mothers, and it helps decrease bleeding, particularly right after delivery. So good for you that you are here learning about this. So some of the questions that parents ask is, how long should I breastfeed? And according to the American Academy of Pediatrics, exclusive breastfeeding is recommended for the first 6 months, and then complementary breastfeeding for however long that you want. But the World Health Organization recommends continuing to breastfeed until the age of 2 or longer. And in some of those countries, what that I should say in third world countries, it helps to space out births, which is better for mom's health. So that's why the World Health Organization has that recommendation. So one of the things you'll hear me talk about a lot, and even when you're in the hospital with your baby, skin to skin. Skin to skin is the best way to start every single feeding. Stripping baby all the way down to diaper and as much of your skin area, whether it's mom or dad or any parent who wants to do skin to skin. It's very calming for baby. It helps regulate their temperature and their blood sugar. And if they're fussing, it's just like a nice reset button for them. It also helps them to transition. So right after delivery, as long as things are going great, they're going to encourage you and take that opportunity to do skin to skin. In the first several days and even weeks, it's beneficial because it also helps to reduce postpartum depression and anxiety. If we had no interruptions after delivery, if baby was placed right on your chest, babies can actually find their way to the breast, just like puppies and kittens do. But sometimes with our interruptions that we do with the medical interventions, it is necessary to help them a little bit. But they would eventually find their way there all by themselves. In order to promote breastfeeding, and according to the American Academy of Pediatrics, they recommend rooming in, which is having babies sleep in the same room as you for the first 6 months. It helps for breastfeeding because you'll hear their feeding cues and hear them starting to stir, and it really is actually beneficial for sleeping for parents as well. There's a lot of information about breast pumps. Check with your insurance. There's some good websites to log on to, and they'll help reach out to your insurance. nebmedical.com is a good place to go. They offer good breast pumps, and no matter your insurance, they offer those same breast pumps, so that's a good site to check out. Things to do before you have your baby. You're getting ready for all kinds of things, but assemble your supplies. Supportive bras are helpful. We talked a little bit about already about your breast pump. Nipple creams. Nipple creams are optional. You really want to do nipple care using your breast milk first, but if you'd like to use nipple creams, that's also something to gather. And then the most important thing is having a supportive group of family, friends, and even additional support groups or lactation consultants to help you with your journey. Sometimes moms are concerned that babies cannot breastfeed because maybe they have some different nipples. There are everted, flat, and inverted nipples, all kinds. We're all different. But babies don't know the difference, and they can learn to breastfeed on any type of nipple. Basic breast anatomy is your body produces breast milk in the lobules, and then comes out the milk ducts. And we'll talk a little bit about latching, but to keep it simple. So once your body starts to produce milk and the larger volume of milk, when it starts, after baby starts latching, you're going to experience the letdown. Some moms feel a little bit of tingling, and that's when the milk starts to spray. But not everybody has that experience as far as the tingling, so that is individual. One of the most important things about breastfeeding after skin to skin is to remember that if your baby's telling you they're hungry, then you want to make sure that you feed them. If you follow your baby's feeding cues, which is when they're telling you you're hungry, they're hungry, those are the things that help you produce a good milk supply. Goal is babies should eat at least 8 times in 24 hours, but they can eat as many times as they want. So much more often, it's probably more like 10 to 12 times in 24 hours. The more often baby feeds, the more that helps boost your milk supply. And at any time you notice a decrease in milk supply, by increasing either breastfeeding or pumping, you can help increase your milk supply. Pacifier use is another thing that can help decrease risk of SIDS in babies, but pacifier use is usually recommended that you get breastfeeding established before you introduce a pacifier, and that would be after 2 to 3 weeks is when they consider breastfeeding to be established. The reason why you want to exercise caution and wait on that pacifier use is because if baby's sucking on a pacifier, they might be telling you that they're hungry, and occasionally it can create latching issues with babies, so you want to just hold off on that if you can. So the first milk that your body produces is the colostrum. That's the yellow the yellow first milk that your body starts to produce in the last several weeks of pregnancy. The next milk is the transitional milk. That's like a thin and white. And mature milk is a little bit more watery, can be slightly blue to white. The biggest thing with breast milk is it can actually be a wide range of colors. Just like we're all individual, it can all look a little bit different. And the other interesting thing about breast milk is that breast milk is age specific, meaning that your body produces the type of breast milk that baby needs. So if you have a preterm baby, that milk is different than if you have a mature baby. And the breast milk changes as baby grows. So it's not exactly the same. Another way to talk about feeding on cue is baby-led feeding. So if your baby's telling you you're hungry, so you may also hear that terminology. You do want to be aware that it's not been too long since a feeding, such as more than 3 to 4 hours. If you go more than 3 hours, it's okay for baby to have one stretch of about 4 hours in 24 hours. But in order to get all of the feedings they need, that would mean that another stretch of time they would be feeding more frequently. And then we never want to limit their time at the breast. So if babies are making sucking motions, kind of wiggling around in the crib, crying is also a feeding cue, but that's a late cue. So catching them early, watching for those earlier cues is going to help breastfeeding go much better. And then when they're latched and they're feeding and eating well, you never want to limit their time at the breast. You want them to go as long as they want. Thinking of it this way, that we all eat at a different pace, and not every baby is done in 10 minutes or 20 minutes. Colostrum, that first milk, is a small amount. Many times we don't even perceive that we have it. Sometimes moms will say they don't have any milk right away. But the amount we have is small because baby's belly is small. It's about the size of a marble or a grape. 5 to 7 mLs or 1 to 2 teaspoons is all baby needs for a meal for that first 24 hours. And then by the second day, their belly is already picked up and about doubled in size, 22 to 27 mLs. And then can they eat more than that? Yes, babies can eat more than that. Their bellies do stretch, just like ours do, but they don't need to have that much. So getting a good start to your feeding is making sure you're comfortable and baby's calm, close to you, and they're in a comfortable position. So making sure that baby is nice and close, in nice alignment, and well supported is going to help them feed their best, particularly with a newborn. All right. So one of the things that parents will ask, or moms especially, when they come in, is they'll want to learn all of the feeding positions or the holds for breastfeeding baby. There are several, but it's really only necessary to know how to feed your baby in one position while you're here. Usually we'll help with a couple positions, but as long as baby gets on with one, you're okay. One of the positions that is really common for us to hold baby in is you're going to hold baby across your body, support baby behind the ears, and bring baby to the breast. This way, you're going to do nipple to nose like this, and you're going to support your breast while baby's feeding. And that's one of the most common ones we use. The other one you'll see us use in the hospital would be the football hold, in which case you're tucking baby this way, hips back in here, and once again, nipple to nose, and getting that deep latch. So when you're latching baby, you're looking for nipple to nose, for them to come in below or at the areola so that the nipple is going to the back of the mouth. If baby comes on straight, baby's going to get a shallow latch and you're going to have more nipple pain. A lot of times when you're getting baby to latch, we worry about the nose. As long as you're holding baby here and baby has a little bit of space, we don't have to be too stressed about the nose. You're going to see baby's nostril, and you don't want to pull too much away from baby's nose, because if you tug too hard, you may pull the nipple out or cause yourself more nipple pain, so you do want to be careful with that. When you're bringing baby to the breast, you want to wait for that wide open mouth. Once they have the wide open mouth, you're going to be able to get that nipple in farther. Things that tell you it's a good latch is you don't want to feel nipple pain. Breastfeeding should not be painful. You might feel a strong tug. Sometimes you'll feel a tiny pinch at the beginning, but that should go away. But if those things, if you're having a lot of pain, you definitely want to ask for help. All right. So as far as we talked about not limiting baby's time at the breast, you're going to let baby finish one side, so feed as long as they want on that one side. And then you're going to take baby and you're going to burp baby. The most common way you'll see us burp babies in the hospital is in a seated position on the knees. And then you're going to place your fingers on the cheekbones, tip baby over, and you're going to pat. And don't be afraid to give a firm pat. If you do just little taps, it's not necessarily going to be enough to get those burps up. So a firm pat isn't going to hurt them, and it's going to help you get those burps up. And by having the hand here, puts a little pressure on their belly as well, and is really good at getting those burps. Another way is to, this baby doesn't always do it really well, but is put baby on your shoulder and just make sure that you're leaned back a little bit, or you have your hand on the back of baby's head so that they don't flip back, and then pat them here until you get a burp. All right. Another common question that parents ask is, how do I know if my baby's getting enough at the breast? If your baby's eating at least 8 times in 24 hours, they're likely, they're doing a pretty good job. And then we're going to count wet diapers. The first day of life, we need 1 wet diaper. Day 2, we need 2, and so on through the first 4 days. By day 5, your volume increase has happened, so you're getting a larger supply of milk, and baby should be having at least 6 very wet diapers. We also count poops, and we watch that poop color change from the black sticky meconium to what we call the yellow seedy mustardy poop. And that happens over that first week as well. But the most important thing as far as hydration is how many pee diapers is baby having. And we also monitor weight loss. All babies lose weight. We just want to make sure that they're not losing too much weight. So, also, the other question that parents will ask is, how do I know when baby's done eating? So if your baby is getting to the end of the feeding, they're usually going to be sucking less frequently. You're not going to be feeling those strong tugs that you're going to feel at the beginning, and more frequent pauses. Sometimes they're going to be able to just fall asleep or come unlatched, and of course then and you'll just kind of watch their bodies relax. Usually they'll have a fist that they open while they're feeding, and those swallows that you were hearing at the beginning get less frequent, and that's a good way to see how satisfied baby is. So in those first couple of weeks, the most important things to watch for is breastfeeding your baby on cue or on demand. So anytime they're telling you that they are hungry, you're going to go ahead and feed them. In the first couple days of life, babies tend to be pretty sleepy, so keeping baby engaged, meaning keeping baby awake, sucking and swallowing, things, not letting them just sleep at the breast. When they finish on one side, you're going to offer the second side, like we mentioned before. But not every baby does both breasts at each feeding, in which case you would just start on that side the next time. The first day we talked a little bit about babies being sleepy, so that we're going to be waking babies more frequently that day, waking them to feed. On the second day of life, it's like they kind of flip a switch and they start to give you cues more frequently. And they go through periods of time. Sometimes it's 1 hour, sometimes it can be 3 hours where they want to feed, and you're going back and forth between sides. We do refer to that as cluster feeding. So you'll see a lot of that on the second day and again on the third day. So as long as we have our diapers and baby's weight loss is okay, we can just keep putting baby to breast. What they're doing is they're really working on building that milk supply. By the fourth day, we're starting to hear more swallows, and you're going to notice baby being a little bit more content at the breast. And then the fifth day, we're looking for 6 very wet diapers, because by day 5, that volume increase should have happened, and you'll be hearing lots of swallows and having those wet, we like to call them wet squishy diapers, where you're really feeling a heavy diaper from the pee. Things to focus on the first couple of weeks after you go home is if people come and visit, let them bring you things, accept a lot of support, focus on breastfeeding, drink to satisfy your thirst, following a balanced diet, and then if you need support, reaching out to your lactation consultant. Partner support is really important as well, and there's a lot of things that they can do to help and be involved in the feedings. They can do skin to skin with baby, which is a great bonding opportunity. Take turns with diaper changes, helping get the baby at night, but most importantly, just being patient, remembering that this is a learning experience for mom, dad, and baby, and that none of you have done it before, so just be patient. It's a learning curve. Some of the breastfeeding hurdles would be the cluster feeding phases, sleepy babies. Some babies remain sleepier even after the first couple of days, so keeping baby awake and engaged, having sore nipples, sometimes expressing milk is necessary with nipple pain, but hopefully getting a good latch is going to help improve that. So sometimes when your volume comes in, and it can take up to 5 days for that to happen with your first baby, your body suddenly sends you all this milk. Your breast can get what we call firm and hard or engorged, and it gets harder to remove that milk. So what's most important over that stretch of days is to make sure that you're feeding baby frequently. If baby's going longer and you can't get baby awake, then you would want to make sure that you pump. When we don't get that milk removed, it can get harder. Your breasts kind of swell during that time, so doing warm compresses, warm heat, expressing milk frequently, not removing that can lead to blocked ducts or breast infections. So also applying some gentle breast massage, starting in the affected side and moving towards the nipple, can help with blocked ducts and help prevent mastitis. Breast infection or mastitis, you would be managing the same way, but if you see any redness, I always encourage you to reach out to your OB. You don't want to let that get out of hand, and it can be really, it can happen quickly. So if you're doing some warm compresses, some massage, and you're seeing some redness that's not resolved in a few hours, definitely reach out to your OB. You would call for a fever greater than 100.4, or if you feel like you have redness that's not resolving. It can be in one side or both. And a lot of times people describe it as like, you feel like you have the flu. Your whole body can get achy. Sometimes moms have had breast surgery and they're concerned if they could breastfeed. But after surgeries, you can still breastfeed. I would just recommend following closely with a lactation consultant. Depending on which surgery you have, sometimes there can be a little decrease in supply, but many moms breastfeed successfully with no issues. Nursing strikes sometimes occur when babies are going through transition periods. So it could be like if they're having a mouth pain or ear infections, if they've been separated, if something changes in their routine, which may cause them to refuse the breast. So things to do through that period of time would be do some cuddle time, do skin to skin, snuggle, make sure you're pumping if baby's not latching. You could do cup feeding, spoon feeding, bottle feeding if necessary. But just focus on spending a lot of time snuggling, and a lot of times you can work through that stretch of time. Something to watch for after mastitis. Sometimes when you've been on antibiotics, you can get fungal infections, and the skin would be pink, red, flaky. So if you see anything unusual after an antibiotic, I would reach out to your OB doctor again. If you end up with a fungal infection, what's important is that you would want to have baby treated as well. Babies will sometimes get thrush, which is a form of the fungal infection, and if you have no symptoms, you still want to make sure that you get treated. This fungal infection can be passed back and forth, so you want to make sure that you take care of it meticulously. So you have to be really careful to wash everything well. So getting that treated as soon as possible is usually your best way. But you would even want to boil pacifiers and your pump pieces and all of those things. There is information about that in your books that you will get when you have your baby. So breastfeeding multiples, your body can actually make enough milk to breastfeed more than one baby. Having a feeding schedule and following closely with a lactation consultant is always a good plan. And usually approaching it with a little bit more of a schedule is helpful, but still watching for baby's feeding cues. If babies are born early, less than 37 weeks, breast milk is even more important. It helps improve their outcomes, help decrease infections for babies, and it would be important to start pumping or expressing your milk as soon as possible. The goal would be to pump 8 times a day, and just be extra patient with baby as they're learning, and reach out to lactation support. Drugs and alcohol, you want to avoid any street drugs or marijuana, but alcohol, a limit of 1 drink per day and waiting a couple of hours until the effects have worn off. And you'll find more information about that in your book as well when you come. And you want to avoid smoking as much as possible, or if not altogether, because it does pass to the milk and it can decrease milk supply and increase risk of SIDS. And most medications, over the counter or prescription medications, are safe. We do have a book here that we can check that for you if you're concerned, but you do want to be cautious with any antihistamines or decongestants because some of those can decrease milk supply. And any hormonal birth control can also decrease milk supply, so you want to make sure that you make that choice carefully. Eat a variety of foods. Talk to your doctor about when it's appropriate to start exercising. Drink plenty of water. Try to reduce stress and relax as much as possible. I know that can be hard. Hand expression is a method of expressing milk that you can do anytime you're separated from baby and is most commonly used in the first 24 hours. The reason we would use hand expression is because hand expression removes more colostrum than any other method. So if baby's not with you or if baby's sleepy, you can do some hand expression. And you can even do hand expression the first couple of days after the feeding. It helps increase our milk supply, any stimulation to our breasts in that first 24 hours. So when to express breast milk is any time that you're separated from babies, if babies are having latching difficulties, early babies like we talked about, premature babies. If your breasts are really engorged, it would be a time to pump. And some moms choose to exclusively pump. So I want to talk a little bit about hand expression before we move on. So with hand expression, you would do a little bit of breast massage. So you would roll your breasts between your hands, just roll it right along here. And then you'd place your fingers on the edge of the areola, press back, and then squeeze behind the nipple. You don't want to just squeeze the nipple. So squeeze behind the nipple, line the edge of the areola. And sometimes it takes a few compressions to actually get the flow going. So I would recommend you looking up, videos about it too. That can be really helpful. Hand expression is something you can actually do if you're not a high risk pregnancy, but you can start harvesting or collecting a little bit before you come to the hospital. High risk being don't do it before 37 weeks and don't do it without talking to your OB provider because pumping early or hand expression can cause preterm labor. So please, please, please don't do it without talking to your doctor. If you're having to pump, some moms exclusively pump, like I said, you'd be pumping at least 8 times a day, about every 3 hours. If you're getting ready to go back to work and you're trying to build a supply, pumping like once a day, first thing in the morning, and talking closer with a lactation consultant if you're returning to work and you want a pumping plan is helpful. Pumping in the morning after feeding is one of the best times to start getting a little bit stored up. And that may mean, because if you're latching baby and you're breastfeeding, what you're getting during a pump session is a little bit less. So you might have to do a couple of them through the day to start collecting. Anytime you notice a dip in your supply, you can breastfeed baby more frequently, like I talked about earlier, or you can pump more frequently. For your first pumping session, make sure you sterilize all your parts, get everything assembled, and have a good place to wash your parts. Check with your, read your instructions on your pump, because each specific pump, some of the pieces can be washed in the dishwasher and some of them cannot. So make sure you double check on that. If you have an option to wash them that way and you're doing a lot of pumping, I would recommend that. One of the things to keep in mind too, though, is no matter what pump you have, don't ever wash your pump tubing. The pump tubing does not come in contact with the breast milk, and it's really hard to get the water out, so don't do that. And then you're gonna make sure you wash your pump parts between each use and let them air dry. And I always say after you wash them in the hot soapy water, triple rinse to make sure they're rinsed really well. So sanitizing your pump parts you can do in a dishwasher on the heated dry setting, boiling or steaming or bleach if no other method is available. I would recommend your dishwasher or boiling it. I think those are the two easiest methods. All right. So milk storage, breast milk is good at room temperature for 4 to 8 hours. In the hospital, we tend to follow the narrower guideline of 4 hours, particularly if babies are in the NICU. But if you are planning ahead or you left breast milk out, up to 8 hours at home is fine. In the refrigerator, it's good for 4 to 8 days, and in the freezer, it's 6 to 12 months. Once you defrost your milk, though, now you have a different window of time. Once it defrosts, you have 24 hours to use it, and you want to make sure you store it in the refrigerator. It is only good for like 1 to 2 hours at room temperature. And then after you've defrosted your milk, make sure you use, and you start with the feeding. If there's any leftover, you want to use that in a couple of hours. When you're getting ready to return to work, things to consider is making sure you have a pump space. By Illinois state law, your employer is supposed to provide a place that is not a bathroom or a closet to pump. And then, if possible, going back to work slowly, like having a short work week or working shorter shifts, things like that can help the transition if that's even possible. If your baby's been exclusively breastfeeding, one of the things to consider is introducing a bottle at about 4 weeks. And then once you introduce a bottle, making sure that you offer a reminder bottle about every week. Some babies will take bottles early on if moms have had to supplement early. And then babies start doing really well at the breast and will refuse the bottle. And that can be an additional stressor when you're returning to work. After about 3 to 4 weeks of breastfeeding, starting to store up milk is a good time to start getting a little bit of a stock there. And just remember, you don't have to have a freezer full of milk. You just need enough milk for when you're separated from baby. I think sometimes the social media and all the stuff we see makes us feel like we have to have a huge store. And then planning meals, family support, all of those things are real important when you're returning to work. When you're home on the weekends or in the evenings, just plan on doing lots of snuggle time and breastfeeding and then preparing for your next day. Some of the things to consider with artificial milk formula is that introducing formula can decrease our supply. It tends to space our feedings out. There are medically necessary reasons to supplement babies with formula. But non-medical reasons in particular can increase risk of low supply, cause engorgement, latching issues, and it tend to shorten our exclusive breastfeeding rates and can actually affects the flora of baby's gut. So breast milk is kind of like a probiotic for babies and colostrum. So when we kind of mess with that, it does throw them off a little bit. And if you have any other questions or concerns, don't hesitate to ask your nursing staff. Thank you.